My name is Jacqueline Uitz, and the psychological disorder that I will be talking about today is going to be autism spectrum disorder. Um, this disorder is very close to my heart because I do currently work with children with autism. I am an ABA therapist. I just became one, but it is something I take a lot of pride in. So, what is autism spectrum disorder? So, this refers to a lot of disorders in the brain. So, it's a lot of complex developmental conditions that involve persistent challenges such as social interactions, speech, nonverbal communication, and there's a lot of tendencies of repetitive or restricted behaviors. Um, and these symptoms are very, very different in each individual. Not one, not each person that you meet with autism is the same. I guess you can say there's a high functioning and a low functioning, which I will go over a little bit later. Some background history to this. Um, in 1910, a Swiss psychiatrist, Eugene Buehler, used the word autism after the Latin word autismus. Um, in 1943, a psychiatrist, Leo Kanner, published a paper describing 11 children who were highly intelligent but displayed a very powerful or desire for aloneness. And he also mentioned that they had an obsessive instance on persistent sameness, so they needed everything to kind of be the same, like a routine. He actually calls this eventually earlier infantile autism. And then later on in 1944, German scientist Hans Asperger describes a form of autism in which the child had trouble with social interactions but obsessed in specific things. Um, so he had a hard time They had a hard time. That child had a hard time communicating with others. However, he found one specific thing that he really was very interested in. Like, he really wanted to do more research into it and everything. And then in 1977, a research on twins found out autism is largely caused by genetics. So it's a lot of it's a neurobiological disorder. Some treatment history and outcomes. In 1911, Bueller uses autism to describe schizophrenia symptoms. In 1920, electroconvulsive therapy was used, as well as emergent dietary restrictions were recommended. In 1940s, Kanner and Asperger highlight autism as a social and emotional disorder. And then later on in the 1950s, parentectomy is a common treatment used between the parent and child. And then moving forward to the 1970s, Temple Grandin develops a squeeze machine, which is a lot of sensory input for the child. So that included shock therapy and aversive punishment. A gentleman named Guy Berard developed auditory integration training, as well as pharmaceutical treatments arised to help with aggression and mood swings and things such as that to with children with autism. And in the 1980s, a gentleman named Ivar develops applied intensive behavioral therapy. And later on in the 1997, an emergency of special education programs were developed in schools, requiring them to provide the necessary help in order for them to be successful in the classroom. So a little bit more about the electroconclusive therapy. This is a small electrical current that passed from the brain to trigger a brief seizure, which hypothesized is to change the brain's chemistry to reduce symptoms um, such as repetitive behaviors. A restricted diet was also recommended and believed to be helpful with kids with autism, because they believe that the toxic dietary factors triggered the autism more. So, gluten free and casein free diets, proteins and wheat and milk were what they usually had to eat. Parentectomy was basically removing child from parents for long periods of time to reverse defense mechanisms. So, um, obviously, children and their parents are very close, and when the child is not with the parent, usually they tend to have behaviors that um, relate to tantruming or yelling, screaming, crying, and in order for them to be able to be away from their parent, this type of therapy was used in order to reduce the behaviors they were doing while they were away from their parent. Temple Grandin um, developed a machine that gave full body squeezes, so it's a lot of sensory input. Um, he also was a person diagnosed with autism. He was considered high functioning, which meant that um, he retained a lot of information and was able to uh, somewhat hold conversations and be able to interact with peers. Aversive punishment, punishing a child for unwanted behaviors. So, for instance, if a child started to be aggressive towards an individual, he would take away something that they like or that they enjoy in order for them to understand that if they behave a certain way, that they get their favorite item taken away, which in their mind will make them reduce that behavior so they could get the wanted item. A little bit about auditory integration training. The treatment involves exposing children to variations of sounds. So a lot of children with autism have to do a lot of have to deal with a lot of sensory. So sound, touch, taste, seeing things. So this type of treatment actually helped because it reduces the aggression that some kids with autism have with high frequency sound. And there was actually, I believe, a mother who published a book about her child who had autism called The Sound of a Miracle. And her son was in auditory integration training, and this actually helped him because it decreased his aggression towards hypersensitivity to different sounds. And this type of training exposed him to all types of sound, so his body and his brain had to be able learn to compose it itself to be able to handle things such as that. some medical and psychosocial treatment, so skills training. So that's a lot of like ABA therapy. Where I work currently, it's at a clinic with children, and a lot of the times, well, it's kind of hard right now with COVID, but before a lot of the times, um, the children would be in the same room, kind of like a school, and they would be able to have that interaction and be able to see if they initiate that conversation, that first hello, good hello, means a lot when they do it. um some medical treatments, so some prescription drugs, so risperidone, uh a riprazole, and clozapine are a few that are um prescribed to children with autism because of their behaviors, their moods, their depression, OCD, um, anxiety, and things like that they also suffer from. Some behavioral observations that you see in children are a delay in communication skills. So a lot of them lack the ability to hold a conversation or to speak um for a matter. They lack a lot of social skills, so when they're around other people, they actually don't even realize that there's other people around them. They're kind of in their own little world. So getting them to socialize is a number one factor as well. They have a delay in motor skills. A lot of them, like in my clinic, we practice a lot of school related work. So like writing with a pencil, cutting, coloring, drawing, and just fine motor skills. And they have a delay in sensory skills, so a lot of them don't realize that these things make these sounds, or they feel this way, or they taste a certain way because they are not exposed to that. They're not used to so many different things. They usually have a routine or a daily meal that they eat every day, no matter what. Some behaviors include restricted behaviors. So a lot of them tend to fight you off from when they want to not do something. They have a lot of repetitive behaviors, so you'll see a lot of fidgeting, a lot of eye twitching, a lot of repetitive word sounds, um, a lot of word, a lot of repetitive words, and just little behaviors like that. They'll have maladaptive behavior, so some kids bite themselves, some kids yell, scream, cry, kick, fight, punch, scratch. Um, and a lot of them have unusual interests in things. So what I found out is that a lot of the kids I work with have a tendency to um, want to touch their personal parts. However, a lot of them have eventually outgrown that tendency. Functional assessment. Three types of functional assessment. So direct observation. So the observer watches the client and records. Two, informant methods. So it comes from interviews and questionnaires that are from like the family, friends, and teachers that the child works with. Functional analysis. Practitioners change the patterns of behaviors. Um, yeah. Some strengths that I've noticed in children with autism is that a lot of them are very highly intellectual, that a lot of them have amazing memory. Like you wouldn't have even known that like this 5-year-old little girl can remember all these things from a book that she only read once. And it's crazy because I can't even do that. So I could only imagine um what what other things she remembers and just knows. They have ability to um have strong interests in things. So like a lot of them have strong interest in animals, and they'll know everything about that animal, where they come from, what sound they make, what color they are, how big they get, how much they weigh, and things like that. Um, and there's high functioning and a low functioning autism. So low functioning is usually considered children who are nonverbal and lack a lot of, I guess you can say, behavioral things that they need um, when they're outside with other people or indoors just with their family. A high functioning, I would say, would be a lot of the kids who are able to um, speak to you, be able to initiate that they want to talk. A lot of them are just very highly intelligent and motivated to learn and do things. Some defense mechanisms include repetitive behavior, so like the fidgeting, the sound making, and things like that. They use that as a way to get out of what they need to be doing. Like a lot of them will bite themselves or show aggression towards you, and just do anything that they could to get out of whatever they should be focusing on. For instance, I have a patient who does not like to ride his bike, and all he has to do is ride it for about 2 minutes, which is about 2 or 3 laps around the clinic, and he will have a tantrum and throw himself to the floor and kick and scream just because he does not want to sit on that bicycle, put the helmet on, and ride it. But once he gets on the bicycle and starts riding it, he has a lot of fun. And but it's something that he struggles with. A lot of kids with autism struggle with transitioning from one thing to the next, to the next, to the next, and that's something that we teach them as therapists to do, because it's not okay for them to always throw a tantrum to get out of doing something that they should be doing as a normal kid. Um, so we try to teach them to accept the transition, accept what they're being told to do, and do it when they have to. Because when they get to school, that's how it's going to be. It's very structured. The teacher's only going to ask once, and they should be able to follow. Identifying syndromes. So some common symptoms of autism are social impairment, communication difficulty, repetitive behaviors, reduced eye contact, and specific routines. Differential diagnosis, so what looks similar to this disorder. So Fragile X syndrome, it's an intellectual disability. Tuberous sclerosis is a benign tumors in brain or other organs, and it can affect the way that individual speaks because of the tumors. Epilepsy or seizures, like brain activity. Williams syndrome, Prader-Willi syndrome, Asperger syndrome, as well. Diagnosis of the psychopathology and comorbidity. So a lot of kids with autism have um, phobias, they have anxiety, they have OCD, they have depression, they're bipolar, they're schizophrenic, they have seizures, they have a variety of different other symptoms that relate to what they have, which is autism. Treatment plan and likely prognosis. So, a likely treatment plan for a child will be different. However, a lot of them have applied behavior analysis, speech therapy, verbal behavioral therapy, occupational therapy, and relationship developmental intervention, which is basically helping them create relationships with others. The contribution this assignment has made to my knowledge of psychopathology has been immensely huge, because I work with kids with autism, and before this I never would have tried to research a little bit more about it. I knew like a handful of things about this disorder, and having to research it a little bit more and dig deeper and know why these kids feel the way that they do and do the things that they do, because they just can't help it, that it's something that they have to learn, and it's something that ABA therapy is there for, to be able to help them communicate and be able to be around other people and just be able to live a normal life.